is my honor to be presenting ByeByeHIV with Thai innovation today, which is the world's first plant-based, safe and effective for HIV and AIDS. Now, HIV, as you know, attacks CD4, which is the immune cell, weakening the immune system. Untreated, HIV progresses to AIDS or acquired immunity deficiency syndrome. When CD4 count decreases below 200 copies per milliliter, and when opportunistic infections occur and lead to death. A few people have been killed of HIV with stem cell transplant, but the treatment is not practical for everyone. Antiviral drugs have to suppress the HIV or expansion, but do not cure the disease. In addition, antiviral drugs have many side effects and must be taken for the whole lifetime, leading to a shortened lifespan. I am now announcing today ByeByeHIV innovation, the plant-based immunotherapy to achieve undetectable HIV and normal health conditions. The formula for the ByeByeHIV innovation is a synergistic mixture of refined extract from mangosteen, sesame, soy, guava, and Centella. Human immunodeficiency virus have been the public health for over 40 years, with 40 million dead, 39 million living with HIV at the end of 2012. We achieved the ByeByeHIV into groups of individuals. Group A is those who were infected with HIV and have not taken any antiviral drugs. They came directly to us and we cured them. We get their undetectable HIV after taking the ByeByeHIV formula. No drug, not even a single capsule of drug. You can achieve ByeByeHIV with this immunotherapy. In Group B, this group of individuals have been infected with HIV and have been taking antiviral drugs to reduce the viral load and to keep the viral load undetected, but with undesirable serious side effects. With ByeByeHIV, they can stop taking the antiviral drugs and maintain normal health conditions with undetectable HIV. Now, ByeByeHIV formula, 4 capsules a day, has been proven to increase in 15 days or stimulate Th1 by 200% and Th17 by 500%. Both Th1 and Th17 boost killer T cells, which selectively kill the virus-infected cell without harming normal cell. 9 capsules a day of this formula for 4 weeks can increase CD4, which is an immune cell, by 60%, and increase CD8, which is a killer T cell, by 17.5%. This is how killer T cell works.
Killer T cells prevent foreign matters from entering the body and eliminate those that made it in. Here is a killer T cell's white blood cell that has been stimulated. It stays in the bloodstream and goes around to greet other cells. If it finds them to be normal cells, it does nothing and moves on to others. But when it finds an abnormal cell, such as an infected cell, which shows an antigen on the surface of the abnormal cell membrane, the killer T cell makes contact with the abnormal cell and binds to its antigen. The killer T cell then sends signals to recruit other white blood cells to help deal with the infected cell. At the same time, the killer T cell releases perforin, shown here in pink, at the infected cell surface to generate pores in the infected cell. After creating a pore, the killer T cell releases granzymes, a type of cytotoxic protein, into the infected cell. The infected cell, which is also a protein, is destroyed, and the virus inside the infected cell, also a protein, is destroyed completely. This process truly kills the virus, in contrast to the other methods like using antiviral drugs that works only to suppress the virus from replicating. Therefore, immunotherapy produces a result that is different from that achieved by the use of antiviral drugs.
2014, the ByeByeHIV formula was used to improve the health of HIV-infected children at an AIDS orphanage home, Baan Gerda, in Thailand. All children were undergoing treatment with antivirals, but with not satisfactory result. 17 children had opportunistic infections. 50 children had a low CD4 count. Substantial improvement in the health of all children after the use of ByeByeHIV formulas. That is, the opportunistic infection in all 17 children were cured in 3 months with 9 capsules of ByeByeHIV a day. Those who have low CD4 count, all 50, increased CD4 by 50% in 6 months with 4 ByeByeHIV capsules a day. At the same time, we will see that ByeByeHIV formula can boost CD4 significantly. We had 28 patients who come to volunteer and take 9 capsules a day for 1 month. Their CD4 boost above 200 cells per cubic millimeter. That is above the AIDS level. So they ate free. This is after 1 month. And you see here the blue graph shows the CD4 count before ByeByeHIV. And the red graph after 1 month shows the CD4 of all the patients. 20 out of 20 patients boost their CD4 above 200 cells per cubic millimeter, 100%.
APCO immunotherapy was introduced by Dr.Pichaet Wiriyachitra to Baan Gerda project to help the young orphans infected with HIV who were in a sorry state of suffering. Initially, out of the total of 80 to 90 children, we let a group of 17 try the immunotherapy. After the trial, the health of the children that received APCO immunotherapy improved. They had a bright skin complexion and their bodies really became stronger and healthier. There was one case of a child who had liver cancer. After using APCO immunotherapy for a period, the child became better with real improvement in her body. And today, the child is still alive and using the immunotherapy continuously. In addition, before COVID started, every year Dr. Pichaet would organize CSR activities to look after the children at our orphanage home of Baan Gerda. His thinking is that the children whose health has recovered still have a future ahead of them, so he wants to help with their education. Dr. Pichaet has been providing a fund on a regular basis so that the children who have become physically strong, if they wish to study further or to get job training or anything, can use money from the fund to prepare themselves to go out and live with others in society.
In the year 2015, the National Innovation Agency recognized APCOcap at the time, which is ByeByeHIV formula now, as a Thai innovative product to improve the quality of life of HIV-infected people globally. The ceremony was conducted on the 4th of September 2015. Now, HIV shortened telomere length, which is the protective cap of the chromosome, causing various ailments. Antiviral drugs cause serious side effects, mainly from inhibiting telomerase activity in lengthening telomere. So in repairing telomere shortened by HIV. The combination of HIV and antiviral drugs then will lead to rapid telomere shortening, leading to serious ailments. From our studies, 2 studies conducted by Apple, this is a company on the innovation. ByeByeHIV formulation, 5 capsules a day for 8 weeks, lengthened telomere by 408 base pair in the first 1 study, and 342 base pair in the second study, which is equivalent to age reversal of 5.8 years and 4.9 years. That is to say that those who are taking our capsule who have the age reversal as well. This result was published in the international as indicated here. Now, as a result, ByeByeHIV formula can solve the telomere shortening from HIV and the antiviral drug side effects. In the year 2007 to 2017, ByeByeHIV formula successfully helped over 6,000 HIV and AIDS infected individuals in Thailand to increase their CD4 count, decrease viral load, and improve life quality. And in the year 2014, the first HIV-infected volunteer, Mr. M, took ByeByeHIV formula instead of antiviral drugs. His viral load at the time of 34,462 copies per milliliter dropped to an undetectable level within 12 months. No drug at all, just ByeByeHIV formula. He remained in good health with undetectable HIV for the past 8 years now, even after he stopped taking the formula for 4 years. I think this is a world record. In the year 2022, his CD4 count was 690 cells per cubic millimeter with undetectable HIV for the continuously for 9 years. Now, this shows his CD4 count in the top graph, in the top of the pictures, and the HIV dropped from 34,000 to the undetectable level, and the year after 12 months. After that, in 2020, I sent out ByeByeHIV formula, ByeByeHIV procedure to treat HIV-infected individual was established. We want to establish this standard procedure so that all those who have been infected can come and use in a simple way. For those who have not taken any antiviral drug, they come directly to us once they know they may be infected. We call them Group A individuals. The step is that you test for HIV load, CD4 count, CD4%, then take 3 to 4 capsules, half an hour before meals, totaling 9 to 12 capsules per day, while testing for HIV load, CD4 count, and CD4% every 1 or 2 months until no infection is detected. Step 3, gradually reduce the number of capsules, that is ByeByeHIV capsule. In the first month, reduce to 1 to 3 capsules half an hour before meals, totaling 6 to 9 capsules per day. And in the second month, reduce further to 2 capsules half an hour before breakfast and dinner, totaling 4 capsules per day. Then, in the following months, reduce to 1 capsule half an hour before breakfast and dinner, totaling 2 capsules a day, to maintain sufficient immunity at all times, and he will remain continually in good health. I might say at this point that they can stop taking ByeByeHIV formula altogether, but we would rather advise them to maintain sufficient immunity at all times and remain continually in good health by 2 capsules a day. But after all, we know that the capsule gives you age reversal and good health. Other successful cases, all the successful cases of ByeByeHIV are shown in the following slides. Now this is for Mr. M, which is our first successful case. You see on the upper graph is the increase of the CD4, and the lower graph is drop of HIV. In his case, the CD4 dropped to undetected level, which is ND, after 4 months. Others have the same pattern, the fluctuation of CD4 above the usual normal level. But CD4 and HIV dropped, in this case, dropped to undetected level even in the first month and remained undetected for 37 tests over 3 years. We tried very hard to see whether he still has any HIV. We could not find it. Even the proviral DNA method. Other patients show the same result. That is improvement of CD4 with the drop of HIV in the lower graph. Same here, and number 6, and come to number 7, which is a serious case. Mr.Din came to us when he had CD4 only 4, almost repeated. And worse of all, he has an HIV load of 2.5 million. Percent CD4 count was only 0.7. Now, after 7 months, his CD4 count went up to 522. That's simply because after 7 months, his HIV become undetected. And after that, CD4 will increase significantly. He has now getting ND HIV test for 39 months. In this graph, actually, is 40 months now. So he has been undetected. He has undetected with HIV for the past 40 months without taking any antiviral capsule.
At that time, due to a blood infection and a swelling in both my neck and groin, the doctor initially thought it was tuberculosis of the lymph nodes. He started giving me medicines to treat tuberculosis and antibiotics simultaneously, but I was allergic to both. My body did not respond well to the treatment. After the test confirmed that I had HIV, my CD4 count was only 4, nearly depleted, whereas a normal person should have at least 600 to 1,800. As for the CD4 percentage, which a normal person must have at least 30%, I had only 0.7%. My HIV viral load was over 2.5 million copies in 1 milliliter. This is a photo at the time of my hospital treatment, showing the allergic reaction to tuberculosis treatment, where the skin peeled off, became dry and dark. At that time, I was feeling totally hopeless because I thought my life was probably ending soon, with people who came to visit me gossiping that I would surely die. I got to know Dr. Th1 who advised me to seek guidance on the use of immunotherapy. He is a doctor based at a public hospital. He suggested that I consult with Dr. Pichaet and his assistant. I would like to express my deep gratitude to Dr. Pichaet and Ms. View for their strong guidance on how to take care of myself, which resulted in remarkable improvements. Before starting the immunotherapy, I felt weak, tired, and had difficulty walking. Then, during the first week of the immunotherapy, I began to feel that my body was getting stronger and I could walk to the bathroom by myself. During that time, I had a fever of 39 to 40 degrees Celsius, and the nurses were shocked to see me going to the bathroom and taking a shower by myself. Just before the start of the immunotherapy, I had already lost 22 kilos from 62 down to 40 kilos. But 3 months after the immunotherapy, my weight went up to 57 kilos. And after 9 months, it reached 76 kilos.
However, within 7 months, the HIV virus, which exceeded 2.5 million copies, was not detected in the test, giving us comfort. The upper graph showed a sharp rise in CD4, while the lower graph exhibited a simultaneous sharp drop in the HIV load. The contrast is very clear. How many months has it been since your HIV was undetected?
No HIV infection has been detected continuously for 39 months.
Wow, that's over 3 years.
My latest CD4 count is 717 and CD4 percentage 30%, comparable to that of a normal healthy individual. My body has become strong and healthy.
You want to meet him? He is here with us today. Mr.Din, please. He is now acting as one of the counselors to those who want to achieve ByeByeHIV. Since he joined our company, we have helped a significantly higher number of those who want to ByeByeHIV. Another clap. Okay, the rest of the volunteer or of consumer have similar pattern of increase of CD4 and the drop of HIV in the lower graph. Number 9, number 10, all around is the same. So I go over quickly. Altogether, up to this very time, we have 24 successful cases. In fact, it's more than that, but I will just stop at 30. We have number of cases increased every week. Simply, we are a very small group. We're not a clinic. We are a group of scientists wanting to help people. And the number 24, HIV viral load of 223,000, not dropped to undetected level within 8 months. Okay. So those who are infected with HIV and have not taken any antiviral. They came directly to us. It's very simple, very easy for us. It's okay for me to say it now, but a few years ago we were quite worried. But now it's a simple procedure. Those who are infected with HIV took ByeByeHIV formula, 100%, everyone. If they are not abnormal, if they don't come from Mars, they will get HIV, ByeByeHIV. So, the next group of HIV-infected individuals who have taken antiviral drugs, which is Group B, we have the same suggestion, more or less. That is, test for HIV load, CD4 count, CD4%, and take to 3 to 4 capsules half an hour before every meal, totally 9 to 12 capsules per day for 6 months, or until it is not detected. CD4 is over 600 cells per cubic millimeter, and percent CD4 is over 30%. Then we go to the next step. While still taking the same number of capsules, start reducing the number of the use of antiviral. That's 3.1, reduce to half of the usual doses for 2 months. Then test for CD4 count, CD4%, and HIV load. If the results are better than those, in step 2, proceed to step 3. That is, reducing antiviral to a quarter of the usual doses for 2 months. Then again, test for CD4 count, CD4%, and HIV load. If the results are better than those in the 3.1, then proceed to 3.3. That is to reduce the antiviral drug to 1/8 of the usual doses for 2 months. Test for CD4 count, CD4%, HIV load. If the results are better than 3.2, proceed to 3.4. That is to stop taking antiviral altogether for 2 months and test for CD4 count, CD4%, and HIV load. If the results are still better than 3.8, it shows that the individual has achieved ByeByeHIV Group A. Cheers. Then gradually reduce the number of capsules, that is ByeByeHIV capsules. In the first month, reduce to 1 to 3 capsules a day, half and half before each meal, and totally 6 to 9 capsules a day. In the second month, take 2 capsules, and totally 4 capsules a day. Then, in the following months, reduce to 1 capsule, half an hour before breakfast and dinner, totaling 2 capsules a day to maintain sufficient immunity at all times and to remain continually in good health. Now, the individual who have been taking ByeByeHIV formula has the increase of CD4 as shown in the top graph, and HIV undetected all along. Now, you see here that at some time they stop taking the ARV, which is antiviral. As soon as they stop taking the antiviral, the CD4 increase very rapidly. Now let me show you. It's all the same, so I'll go very, very quickly and point out just a few cases. Now, number 9. Then the important cases is Ms. A, who was infected with HIV. She was infected with HIV for 28 years, has been taking antiviral drug for 28 years. In addition to that, she had advanced stage cancer in the brain, in the abnormal area and spine. Do you think she will live? Do you think she will carry on with her life? After ByeByeHIV treatment, her tests show no evidence of cancer. She stopped using antiviral drug in December 2022. Cancer under control, HIV is not detected, so become ByeByeHIV as well. Just simply the use of ByeByeHIV formulation, one and only kind of capsule. The picture here shows Ms. A after brain surgery. That's when the doctor said she will not live more than 6 months. She have to be bedridden for the rest of her life, which is not very long. But after 8 months of taking ByeByeHIV formula, she started walking. She walked to see the doctor. And now, Ms. A lived a normal life and had resumed work for the past 8 years to support her family. She has stopped antivirals with no HIV detected and has achieved ByeByeHIV. So this is a serious case of cancer, serious case of HIV. But just simply ByeByeHIV formulation can solve all the problem. Now, her CD4 is shown in the upper slide, in upper graph. Start with 620. When we build her up, that's when we start getting her to reduce the ByeByeHIV formula. And now she has been living with good health, I think, for the past 8 years. And the rest of the consumer, Mr. Nut, same result here, ByeByeHIV with the increase of CD4 in the upper graph. And this is a special case here, Ms.View. Her CD4 increased from 625 to 705 with HIV undetected all along. She is here with us today.
Hello, my name is View. In 2016, I discovered that I had contracted HIV. During that time, my health was in a very poor state, with a CD4 count of only 72. I also suffered from various opportunistic diseases, the most severe being tuberculosis of the lymph nodes in my neck, which was excruciatingly painful. The medication I took had many side effects, including muscle atrophy in my limbs, fragile teeth, dizziness, tinnitus, and hair loss. My skin became dry and darkened, and I experienced pains in my joints and muscles. I faced weight loss and difficulty eating. I couldn't fall asleep and had nightmares. Additionally, I developed chronic kidney disease and fatty liver disease. Despite these challenges, I have now successfully recovered and enjoy robust health compared to that of a normal person. I have ceased using antiviral drugs and achieved ByeByeHIV for 6 months. Feel free to chat with me online at the line ID @APCOFC. Keep fighting and take care.
Okay, Ms.View, would you please stand up? Take up your mat. You may feel free to talk to View and Din for the rest of the conference. But in Thai, in English you need to translate. Okay, she is now also acting as one of the counselors to those who want to achieve ByeByeHIV. The next 12 volunteers have similar pattern of increase of CD4 and with HIV undetected all along. So I go over it very quickly until Ms.Kwanjai, who was infected from birth from her mother. She has used antiviral drug for 17 years. And after undergoing ByeByeHIV formula for 14 months, we build her up to high CD4 and get her to stop taking antiviral. She has stopped taking antiviral in March 2023. The graph shows the CD4 count increase every time she stopped reducing antiviral with the same with undetectable HIV viral. Ms. Louise, next one, Ms. May, all the same pattern. That is to say that we are absolutely 100% certain we can help these people. This is number 6, which is the last one. Now, at the present time, this is the latest development. As you see, we had 2 successful ByeByeHIV individuals who had volunteered to act as a counselor to those who want to ByeByeHIV, leading to a significant higher number of successful cases of ByeByeHIV. So what's next? This is our next move. We plan to increase the number of ByeByeHIV counselors, both in Thailand and overseas, with the aim to end the HIV and AIDS epidemic very quickly. I want to end that. This is a safe, easy, very simple way of getting ByeByeHIV, despite the fact that it's been 40 years since they discovered HIV. And up to now, there is no practical way to improve or to solve the problem. Here, with ByeByeHIV formulation, we have ByeByeHIV. And let's see who are the scientists involved in the past few years, not few years, over 10 years. Okay. From the Prince of Songkran University, Chiang Mai University, and APCO, Asian Pharmaceutical Public Company, which is the company I'm running. It's listed in the stock market. And thank you very much. I didn't hear the bell. Should I?
It's not time stop right now. Thank you very much, Professor Pichaet, for your wonderful talk. And now we are moving on to the next section. It's the Q&A session. And please welcome the question from the floor.
You can ask me in Thai. Yes, please.
Good morning, everybody. Thank you very much, Professor, for the beautiful presentation and also very useful treatment by HIV. So it is very interesting since immunotherapy become one of the modality therapy for HIV or AIDS. And also, we can see from the slide presentation that there is a synergistic mixture of many plants. And also, actually, Thailand, I'm from Indonesia. I'm sorry.
You also have mangoes.
Yeah. So in Indonesia, we also have many, maybe all of the component also we have in Indonesia. So
but it will take you 10 more years to accept formulation.
yes. So actually, my focus of my study also focus on herbal medicine, basically in type 2 diabetes, and also recently I study about cancer. So I want to know about the mixture of synergistic based plant. Is it from the you mix all of the bioactive component, or maybe all of the extract? So all the component from the extract, or
I would just say refined extract,
oh,
not a
refined.
full extract,
I see.
and in different proportion for different activities. But for this mixture, this synergistic mixture,
Yeah.
besides treating HIV, we have been successfully treating cancer
Yeah,
and disease, and we have helped over 10,000 cancer patients in the past 50 years, to the point that we have been awarded the best innovative company from the stock market of Thailand.
Oh, that's very great innovation, Professor. I very appreciate. So, yeah, maybe in the future, maybe I will contact you if you don't mind, because in our place also many people with cancer and also degenerative disease, and it is interesting that this treatment also can long the telomere, so it is as anti-aging also, I think. So maybe in the next future I want to.
It is interesting that you can cure HIV and get your telomere lengthened.
Yeah, telomere lengthened, yes. Yeah, that's very
And on
interesting.
that point, we say this is one and only formulation in the world.
In the world, so it's very innovative, I think, and very novelty in the plant-based therapy, I think. And congratulations, Professor. We really appreciate it, and I hope in the future we can have communication. Maybe that's all. I appreciate it. Thank you very much.
Any more questions?
Thank you very much, Professor. So do you mean that ByeByeHIV can also cure patients who have cancer without HIV?
Yes, this formulation can, but we have better formulation, especially for cancer. Call us at 1154. We give you all advice, definitely to help you improve your health condition.
Thank you very much.
Thank you for your talk, Ajahn. Basically, could you kind of briefly explain a little bit about the mechanism of this immunotherapy? How does this active ingredient works to get the result that you get?
You see in the graph that 4 capsules a day in people with normal health condition. After 15 days, you boost the T helper 1 and T helper 17, which are two very effective CD4, which stimulate the immunity. And both Th1 and Th17 is known to stimulate killer T cell, which is a cell that effectively kills selectively the HIV-infected cell without touching the normal cell. And killer T cell is the most magic mechanism in your body that kills infected cell and cancer. There is no other better cell than killer T cell. And we have people who take 9 capsules a day, you increase CD8, CD4, CD8 increase 100 million cells within 1 month. So the increase of CD8 or killer T cell are the ones that's responsible for attacking HIV-infected cells and cancer cells. Okay. And for those who have been using antiviral, that have been very side effect, simply because the antiviral shorten the telomere. Most doctors don't know that. They keep saying that if you get HIV, keep using antiviral. But the longer you use, the worse your condition gets. And I think it's a conspiracy theory. Conspiracy of drug company getting people to get HIV, keep taking antiviral drug, and they will not be killed. They just simply HIV infected with antiviral. That's all. And the longer you take antiviral, the worse is your health condition. But this is the only way. Kill it. Kill HIV. Get rid of it. And live beautifully.
Thank you, Professor, for your talks. And I would like to ask about if the person that obtained this formula also have the autoimmune disorders, such as maybe like the immune that attack their system.
Very good.
So is it really helping in that condition because the killer T cell will be
okay? Very good question. I think this is a very good scientist. A good question from a knowledgeable scientist. Because people who have autoimmune diseases, that is too high CD4, too much immunity. Actually, these people don't usually get HIV. That is not to say if you are autoimmune, just go around and have fun. It's not to say that. But those people who have autoimmune disease usually have higher protection, immunity, and these people don't usually have cancer. But for people who have those conditions, simply because they have been taking what we say immune suppressive drug until the point that HIV attack, until the point that the cell become cancerous. So when you have that sort of condition, first solve the problem of autoimmunity, which we can do. There is a set of products developed from the same 5 extracts, but different extraction, different proportion. Once you have solved the autoimmunity, what can come? The ByeByeHIV.
And my other question is, so basically, how many formula that you develop for, like, how many diseases right now?
Oh, you name it. Whatever disease, we cure it with plant-based immunotherapy. Diabetes, arthritis, psoriasis, whatever, eyes problem. But what we cannot do is stop you from being hit by a car. Yes.
Thank you very much, Professor. That was very interesting. And I'm Bella from Indonesia, and I would like to ask you about the cancer that you mentioned before, that this formula is not only to cure HIV, but also the cancer. And as far as I know, if someone gets the disease of the cancer, but maybe they already claim that the cancer is already gone, but then sometimes the cancer is appeared again.
Okay,
so,
very good. I know what you
Oh yeah, thank you very much.
So as soon as you stimulate the killer T cell, killer T cell has memory. It's a memory T cell. So if you don't get rid of the T cell after you have a patient, you will be free from cancer for the rest of your life. This is a very effective way of treating cancer. That is by increasing killer T cells.
So the effect is permanent, right? Not temporary. Okay.
until you come to use immune suppressive drug to get rid of killer T cells, or use other extract which will affect the building up of killer T cells.
Okay, then. Thank you very much, Professor.
Because our time is limited, we need to end the Q&A session right now. Thank you so much, Professor Pichaet and also Dr. Seda.